Hi everyone, I am Dr. Lynn Wagner and you are listening to Doc's Thoughts, part of the Wealthy Life. Today's video is about sexual performance and your heart. And if you're like most, you care about your sexual performance. This video is targeted to men, but good for all to watch. What we don't all know is that half of men over the age of 40 are going to have some form of erectile dysfunction. And what erectile dysfunction means is that you either can't achieve an erection or you can't maintain it for the length of intercourse. And even if you don't have erectile dysfunction, you want to keep it that way. So this video is really, really important for you. So listen up. Regardless of what camp you're in, you need to start thinking about and protecting your heart. And here's why. Some fun facts to know. Testosterone is not the only driver when it comes to healthy erections. It's a very, very important part. And I've talked about it in the past. We'll link you to that video at the end of this one, but it's not the only driver. There are other things at play. Erections actually happen when you get increased blood flow to your penis through these blood vessels called the penile arteries. If you have no blood flow, you have no erection. If you have good blood flow, you have healthy erections with good staying power, which is obviously also really important. Blood flow can be compromised by many things, but one of the most common things is something called atherosclerosis, which basically means that those little blood vessels start to get clogged up, almost like bad plumbing. So if you have those blood vessels all clogged up and there's no blood flow, you're not going to get a good erection. And what we also don't know is that atherosclerosis or clogged arteries will hit tiny blood vessels first. So the penile arteries are about 1 to 2 millimeters, which is tiny, like, the tip of a pencil. Whereas the coronary arteries are about 3 to 4 millimeters. So that's half the size. So if you think about plaque building up, it's going to hit those penile arteries first. And so when you get those penile arteries clogged up, you're not going to have your erection. Erectile dysfunction is often one of the first signs of heart disease in men. So it starts showing up maybe 3 to 5 years before they have a first heart attack or cardiac event. So it can be like the red flag or the canary in the coal mine. If it's not working down there, there's a good chance that your heart's in trouble. So if you care about what happens down there, take care of what is in here, because if your heart is struggling, your sex life probably already knows it. And even if you don't have any cardiac symptoms, you want to get your cholesterol checked, you might want to get a calcium score, you for sure want to talk to your doctor, and definitely work with a doctor who's into integrative or functional medicine, because you want to protect what is going well for you. So talk to you guys soon, and I hope you enjoyed the information.